So fertility is the ability of couple. And I want my audience to take note of the register I'm using. Couple, not the woman. Because in our setting, the blame of infertility is usually centered on the woman, which is very wrong. So fertility is the ability of couple to procreate, to produce offspring. Now, when it comes to infertility, there's a time component to it, and there's a reason why that is important. Infertility is the inability of couple. I'm still emphasizing not the woman. Because by virtue of my practice, I say a lot of blame is heaped on women because they can produce, which is very wrong.
Especially in the African setting.
Yes, which is very wrong. And women have developed some kind of victim mentality by accepting blame all the time. Now, infertility is the inability of couple to achieve pregnancy after 12 months of regular, unprotected sexual intercourse. Now, those words I use, they're deliberate. They need to be emphasized. A couple, man and woman, not man and man or woman and woman. After 12 months, because some couple, after they go married, I see them in my clinic, 3 months, 6 months, they're already agitated and worried that they have not conceived. It's unnecessary apprehension unless there's a pre-existing problem. And regular sex, when we say regular sex, that is at least 3 times a week. Some couple live together and they only copulate once in 2 weeks. They're not very serious about that idea of having babies. And it must be unprotected. It may sound strange, but there have been instances of people trying to conceive and the woman is on family planning. How would that happen? Or they are using
the woman is on family planning.
Yes.
But that's an agreement between the two parties.
No, there are instances that when couple get married, for one reason or the other one party does not have one babies, and the other is not aware it happens.
But
or there are instances. No, it depends. Families are variables. We see this all the time in the clinic. To the other partner is infertility. For the partner that is using contraceptive, it is not infertility. So these are technical terms for people to understand. And so that when people get married after 3 months and because of societal pressure, they start looking for gynecologists to have infertility. This is not the case. But there are important exceptions. If before they get married, we have discovered that there are pre-existing problems that can mitigate against fertility. Some women already have some problems, or men, they know before marriage, we are not going to wait for 1 year. That will not be good practice. Or if the woman happens to be 35 years and above, because fertility has a very important, age is a very important factor on fertility of especially the woman. So if the woman is 35 years and above, we won't wait for a year. Most of the time, by 6 months, if there's no conception, we start initiating the process of finding out what could be wrong. So this is generally speaking what fertility and infertility is all about.
Let's look at some of the curses, of infertility. Apart from what you have just mentioned, what are some of the curses? Is it a lifestyle? Is it what they eat? Is it just, what are some of the curses?
Now, before I elaborate extensively on the causes, it is also important for us to talk about types. Because generally there are 2 types of infertility, though it may be, it's majorly theoretical and educational. A woman that has conceived previously, is not important the outcome of the pregnancy, whether it resulted in miscarriage, ectopic pregnancy, or stillborn, is regarded as having secondary infertility. But if the couple has never achieved any conception at all previously, it is primary. So the way we manage them, the investigation procedure is basically the same. Now, causes of infertility, I'm going to start with the man first. Because most of the time it is men, and I'm a man. Men usually heap all the blame on the woman, and they are always saying it's a woman problem, which is not true. And the fortunate thing is that it is very easy to investigate men for infertility. It's cheaper, it's less expensive, and it's less invasive. But most of the time, men are nowhere to be found. Though for men, the issue usually has to do with sperm. Whether they are not producing sperm at all, or there's low sperm count. And many things could be responsible. Some men are born with that problem. They have congenital problem. Some men, the testis is completely absent. Some is not where it should be, what with regard to undescended testis. And some of these can contribute to what we call testicular failure. Testicular failure is inability of the testis to produce sperm and necessary male hormones. And many things could be responsible for this. It could be some medications. That's why we advocate people to run away from self-medication. And that's very rampant in our society. People are abusing drugs. Everybody's a doctor in Nigeria, including people, Okada riders. There are times people come to the hospital, we prescribe for them, and they will get in, they say, my brother used it. I should use
my friend said this was what she used. Let me try it.
At times you will discover that the medications that have been prescribed by non-experts is injurious to their health. So there are some medications that also depress sperm count. There are some other medical conditions, like there's something we call testicular torsion. a man suddenly having pain that is not abating and is not treated, there may be an issue with the testes. If not promptly addressed, it can lead to testicular failure. So men who have testicular cancer or they are treated for that cancer can also lead to testicular failure. And also, you know, we are Christians. The commandments of God are not grievous. There are some men that have low sperm count or completely, they don't have any sex because the spermatic duct that carry the sperm cells from the testis to the external world is blocked. And the common cause of the blockage are sexually transmitted diseases, just like they affect women. So these are the common causes of male infertility. And it's important when we give birth to our male children that we examine their testes, the scrotum, to be sure that the testes are in the right place.
Okay.
Because there's something we call undescended testes when the testis is not in the right place.
Okay.
If it is left untreated for long, it can spoil, completely damage that testis. That will be testicular failure. And it's also a risk for testicular cancer later in life. Now, let me go to the female.
So, okay, before you go to the female, sir, so you mean when a child is born, when a boy is born, you need to check the...
It's good in the hospital, let them examine that the scrotum has the full complement of the two tests in the right place.
Okay.
Now, it doesn't mean it is absent.
During, is it circumcision or something? They can also find that.
Yeah, but you know, ideally, when a woman delivers in the hospital, where the health worker will examine that. Now, it doesn't automatically mean when they can find it that there's actually a problem. So whatever is found, they'll be able to do a follow-up to know whether the tests are undescended or they are just temporarily undescended. There are different ways. That's why healthcare workers should address that.